So you and I are here at the Ensemble conference. It's great to be here. It's been a good conference so far. What's been your take?
Lots of new faces, which is great. It means there's new networking opportunities. I think being one of the guys that's been in the Ensemble community for a while, it's also an ideal opportunity to mentor, teach, share information and experience. So
It's always great to be able to see some people that you see every year. And
the friendships are there for real. I mean, I get more hugs than handshakes at this meeting. So yes, it's.
I love that.
Yeah.
That's awesome. And have you had have you had a favorite session so far? Like something that really stood out to you? I'm sure you liked a lot of them, but
Yeah, I actually enjoyed. So I did. Now it's not my favorite session because I was in it. I was in a session earlier today as a panel contributor, and it was just really interesting hearing how peers, friends, and colleagues are viewing some of the same dilemmas that face our industry, both in academic healthcare or even as an outpatient research site. And it's unique because I'm in New England. Somebody else is in a different region of the country, and it's just. We all have the same issues, but we all have to tackle them very differently. It's, if you've seen one software implementation, you've still only seen one software implementation. We all have our own different roadmaps to find those solutions.
And how long have you been a part of the Ensemble community?
I have been coming to Ensemble meetings since 2012.
Long time. No, I'm just kidding.
I'm an old guy. Yeah, you can go there.
Wow.
I have more hair than you, but it's definitely more colored than yours. So
we're going there. Wow. I mean, let me.
You could cut that or leave it.
Get my wig. Get my wig.
Get it. This is why Mel won't do this, because I'm that guy.
I love it. So, can we talk a little bit about how collaboration helps drive clinical research forward, like particularly at Yale?
Yeah. So there's a couple examples of how collaboration works. One, I just left a session where sometimes you have to say what isn't the good, positive vibe story. Because honestly, we're all supposed to be advancing from each other's lessons learned. We all have similar pain points. We all have similar bureaucracies. Maybe the politics at one place is less than the other, but it still maps the same way. So how do we take those pain points? How do we roadmap them together? And honestly, share ideas. I think that's the whole beauty of the collaboration concept. If I've learned it and experienced it, don't make somebody else have to do it. And we always refer to it as the leapfrogging methodology. If we're the innovators, then we expect somebody to leapfrog us because they've built on top of what we've done. And then maybe in a future year, we're going to leapfrog them back. But there should be this constant advancement of leaning on somebody else's lessons. And I think that's the beauty of this. Folks here are willing to share more, not just vulnerability, but share more about their processes, their policies, and their bureaucracy than any organization, any user group, any consortium meeting I've ever been to.
That kind of answers part of my next question.
Good, I got ahead of you.
Around just clinical research evolving over the last several years. Yeah. How does kind of being a part of this community help stay up to date and kind of stay in line with the ongoing changes?
I think the root of that question is actually technology. And I don't mean just technology, because Advara and Encore is a technology solution, but we're looking at, if I look at my Encore implementation at Yale, we've got 15 data integrations. We're using data warehousing solutions. We're already starting to figure out how do we start training our own large language model. Technology really is at the center of some of the activities that we're doing. So the good news is technology is repeatable. So how do we use our tool sets, translate that to other sites, let them learn from us, but likewise, we have advantaged ourselves and leveraged what other teams have done. So I think technology, whether it's custom adaptations, interfaces, integrations, or using standardized interfaces, but again, it comes back to my comment a second ago. We should all learn from each other. And my experience since joining the community in 2012 is, if we've done it, we'll share it to you. And it's not like it was my intellectual property and you have to buy it from me or license it, or I'm selling some good. And I've been in other places in academic research where somebody has a finding, but it's not acceptable to share that with your peers. That is the exact antithesis of what this group is all about. So,
and this event it's only once a year.
Yeah.
How does this community help you on a daily basis?
So we have a lot of standing meetings. I mean, the Advara community, Advara itself as a source of information hosts regular calls as it relates to the framework of each application. So there's standard calls for eReg, standard calls for Encore. When we talk about reporting and analytics, so all of the different frameworks that we operate within, it's a very supportive infrastructure for helping give us the resources that we need to build. So it doesn't have to be, oh great, we're all in a meeting and talking about it once a year. I very commonly have standing calls with the peers and the network that we've built here, and we work offline. So when we get to this, we have a common story to tell and talk about the advancements or the pains we've enjoyed for the last year. So
let's you mentioned Advara obviously a couple times, and
yes.
let's talk a little bit about, why is Advara the best company in this space when it comes to the building the ecosystem between the sites and the sponsors and the CROs?
So I think part of it's industry movement first. I mean, if you go back 3 years, now we're getting into, I guess I'm one of those nerds that follows the business trend too. You see WCG by Velos, you see Advara by Forte, which is how Encore now ends up in the Advara portfolio. But at the same time, it wasn't a one-size-fits-all process for Advara. I think they looked at it and said, oh, we have this Encore solution, but Clinical Conductor also offers a solution to other clients of other sizes. Oh, wait, we have this solution in Longboat. Oh, but it means something else. So I think what we've got is an ecosystem of their own products, but also a focus of how does the technology that they're deploying, developing, and rapidly trying to interact or integrate, how does it also connect to the ecosystem that isn't Advara branded software? So I think it's something they've been really mindful about. They understand that I have a financial system, Workday. My Advara tools had better talk to Workday. I have a drug dispensing application. Encore had better talk to my investigational drug service platform. So again, there's this common acceptance, a common standard of we've got to have the ecosystem both within the Advara toolset and external to the Advara toolset working together.
At Yale right now, what's your most important initiative?
Doing a full-blown financials optimization, financials restructuring. So we're going through ChargeMaster rebuild. We're doing a full-blown redevelopment of our Workday financials interface. And actually next week, which is end of March, once this video gets released, we'll have our new IRB, Huron IRB to Encore and eReg interface active, integration active. So
it's a lot of movement.
Yes. We have got next 14 months of technology projects already lined up. And then we'll get to Encore cloud migration. So keeps us busy.
Yeah, super exciting. It's you need to be, right? You need to it definitely helps. And let's talk a little bit about one of the sessions today during a leadership panel, right? We have a quote from you. Our bureaucracy is stopping us from helping our patients. Can you explain that more?
Yeah, absolutely. So the part of that conversation came up in the context of why we have certain operations administratively that certain institutions feel should always be local at the institution, not centrally at a national level or at a centralized level. And I think part of it is there's always a sense of we have to have a say, whether it's administrative or bureaucratic, about a process, a context, some sense of having regulatory control. So to me, those pieces are there, but at the same time, we also have to trust the system. So if the FDA is suggesting to us that we take a different approach to a regulatory oversight process at the local institution, I think we've been given our directive. So how do we get the bureaucracy or the legacy of that bureaucracy out of the way so we can actually appreciate the efficiency that the FDA is pushing us through? So that's sort of the context of it. Is there are certain boxes you have to check, there's buttons you have to click, there's people you have to talk to, but at the same time, are you just doing it because that's the way you've always done it? And can we get rid of the enemy of good enough is better? Actually, no, better is better. So get rid of the bureaucracy, because at the end of the day, we're all doing this out of some sense of a personal connection, a relationship to somebody who's had a health or diagnosis that has harmed them. And we're all probably connected to clinical research and clinical advancement for better treatment for patients in the future. So why let administration rule that timeline?
Speaking about the future, what are you most excited about moving forward in regards to clinical research?
My ultimate dream of moving forward in clinical research is we all work ourselves out of a job. That's a perfect state, but I don't know that we're ever going to get there. But wouldn't that be amazing? We've discovered a cure for everything. That would be a perfect state. So for me, I'm somewhat of a tech nerd. I'm not a tech guru, just a tech nerd. Wave that nerd flag as often as possible. But from a systems engineering or a process engineering perspective, where have we not realized optimization of using technology to do high cost, low risk, low value activities, administrative tasks? So why aren't we training large language models to do certain things for us that take hours, and in protocol activation, for instance? Or why aren't we using stronger data integrations with better definitions and data dictionaries about this value always means this from your source of truth, and it can transmit across all your structures? Let's go one step further. Why is it that I have to do a data structure at Yale that isn't universal to anybody else that also wants to use that same data structure? So that could be administrative data, that could be clinical structure, but technology is going to have to become more trusted, more uniformly deployed, consistently accepted. And I am that guy that actually worries about the AI robot taking over the world. So I say that with some level of, conservativeness, but it's, if we're going to get better, it's not about throwing more people at it anymore. If we're going to get better, we've got to deploy and optimize technology.
Have you ever seen the movie I, Robot?
Yes. Will Smith.
That like a GIF of him kind of going through the line of all the robots. They said this is what's going to happen in the tech space regarding when the AI puts a bug through, trying to find which AI
which AI is actually the one. Yeah.
It's funny, and there's also a concerning
degree
piece.
of concerned truth here. Yeah. So, but I'm not in it because I think some sense of artificial intelligence is going to take over the world. But we do humanly repetitive actions on an hourly, daily, and weekly basis. That's something you can train an AI platform to do. And most of it's structured data. So if it's a structured data in with a structured output and a system can logically come to the right conclusion, I'm not trying to put people out of work, but we got plenty of work for people to do besides that. So.
Last thing before we let you go. Next year, Ensemble's in Orlando.
Mm-hmm.
Where do you hope it is the following year?
Oh, so that means East Coast, West Coast. We're in Arizona. Now we're going to go Orlando. All right, so West Coast trip. I'll preach it all day long and twice on Sunday. Take us back to Dana Point or San Diego. That's my idea of a good time.
Great spots.
Excellent spots. Good weather, too. Great food.
Absolutely.
So,
California burrito.
Or fish tacos.
Oh, or fish taco. Can't miss. Yeah.
You'll have to ask Mel. There might have been a Dana Point trip where we actually hosted a bonfire on the beach with about 150 fish tacos and literally hosted a party down there for Ensemble attendees.
I love it.
It's what we do. You build relationship. It's not just about the fire or the meeting. It's break bread.
I love it.
So,
thank you so much for
appreciate
chatting
it.
with us here today.
Excellent.
Awesome.
Thanks.